Coming up on Why Should I Trust You? Measles is in the news again, and many in public health are very worried. We're once again seeing outbreaks for something we apparently got rid of in America back in the year 2000. But the question we hear being asked by some Americans is measles really as bad as many in science have made it out to be? Didn't generations of people get it and make it through just fine? And if it's not that bad, if public health is crying wolf on this, do we really need to vaccinate? And hang with me here, if we don't really need to vaccinate for measles, what else are they scaring us into vaccinating for that's just not needed? These are the questions we are hearing from many Americans. So on today's episode, how bad is measles really? Is public health overreacting? And while the majority of Americans still support measles vaccinations, what's the impact of the vocal, powerful, and growing group of parents who refuse to vaccinate? And we hear from some of these moms. We also bring on vaccine expert and pediatrician, Dr. Paul Offit. Let's get started. Welcome back, everyone. I'm Brenda Adhikari.
I'm Tom Johnson.
I'm Maggie Bartlett.
I'm Dr. Mark Abdamali.
My voice, I'm journalist. Brenda's voice, journalist. Maggie, say hi, Maggie, one more time.
Hi, I'm a virologist.
Yep, and Mark is a doctor.
Hey, guys. And a dermatologist, which
and a
measles
dermatologist.
is a skin disease.
There you go.
Oh,
your
my
sweet
goodness.
spot.
You guys are people of many talents. I just want you to know that. Hey, listen, in a moment, we said we're going to talk to Dr. Paul Offit, one of America's foremost experts on vaccines. He's a friend of the pod. And you'll also hear from Melinda, another friend of the pod from episode 1, Fame, along with a friend of hers, to get their perspective on measles. They're both moms and they're thinking about this. Okay, so listen, we're going to dive into this story because, you know, we have cases appearing. I think, Mark, the last count was something like nearly 50.
Yeah, there are about 50 cases nationwide, mostly in Texas, but we'll get into it.
Yeah. And look, this was a disease that we thought we had eradicated here. And the reason we wanted to look into this was because of the sentiment we've been picking up on in some of our conversations with people, which is that many people genuinely don't think measles is all that big of a deal. And this obsession over vaccinating and keeping track of cases is simply an overreaction to an illness that generations of people got and recovered from. So we wanted to find out, how bad is measles, and is there any truth to the idea that getting the disease is actually the best form of protection against it? So Tom, kick us off. What's happening here? How do we get here?
Yeah. So let's start back with what appears to be like the seminal event in the history of measles in America. And it's not like the first case. It's not the day the vaccine was made. It's actually December 26, 1969. And if you were watching ABC on that night, you would have seen episode 13 of season 1 of the Brady Bunch titled, "Is There a Doctor in the House?" And
oh my God, wait.
Yeah.
Pause.
Yeah.
I just need to acknowledge the Brady Bunch was a seminal show in my life.
Absolutely.
Guys,
Really,
I'm getting a lot of texts that people don't know what the Brady Bunch is.
No.
What? No, you're not.
No. We have
There's
callers.
a story
We have callers.
of a lovely
I mean,
lady.
this was like, destination television.
Yeah.
I mean, the Brady Bunch was like the Super Bowl.
Yeah, it was, and it was just rerun city. I mean, for 2 decades after it aired, it was just lived on channel. For me, it was probably channel 11. Anyway, the Bradys all come down with measles in this episode. The kids stay home, and Mike and Carol have to run around and figure out, like, how do we cater to their needs? And it's like a new blended family, and each has their own pediatrician. Anyway, that's sort of the plot line. But it really is a sort of campy episode where the kids all just sort of get to stay home from school. And Marcia has her famous line where she says, "If you get sick, you sure can't beat the measles," as they play Monopoly and have a couple sick days. So this episode has lived on and is thriving today in social media. A lot of Americans who, as Brenda alluded to, think we're making a big fuss over measles, and that big fuss is way overblown, cite this episode and this clip and share it. It's a meme. And it's basically saying, like, we all had measles when we were little and we were fine. And you certainly don't need to vaccinate for it. And public health keeps squawking on and on about vaccinating for measles. And, life used to be simpler, and we were all like the Bradys, and we just got it. We were homesick for a bunch of days, and then we were fine. That episode came out in 1969. That was 6 years after we got our first measles vaccine, and just 1 year after they revamped the vaccine and made it more effective. And for many people alive today, the Brady's experience with measles was their experience, but not for everybody. And this is where we sort of take us back to a time before measles, before people were vaccinated for it. There were about 400 to 500 people each year in the U.S. who died because of measles, and it caused about 48,000 hospitalizations a year. So we had about 400 to 500 deaths a year till we get the vaccine in 63. And by 1969, when the Brady episode comes out, we're down to just 41 deaths a year from measles. So it talks a bit about, or it shows us a bit about the power of this vaccine as we sort of move into the late 60s and certainly the early 70s.
So Mark, let's talk about that measles vaccine. What was it?
Yeah, I mean, so the measles vaccine, it's 2 doses now, but it wasn't always 2 doses. The first is a vaccine that's given, usually around when the baby's 1 year old, and it's 93% effective in preventing measles. And, one of the things we keep hearing about is, why do we keep adding vaccines to the schedule? Our little bodies cannot take it. And measles is one of those vaccines where we did actually add a second dose. And it was added because we realized that for some people, they weren't getting the immunity they needed after that first dose. So we discovered this. There was, we talk about outbreak now, but in 1989, there was a really large outbreak. We went from like 10 times the number of measles cases that we were usually seeing. Like in that 1989 to 1990, there were almost 55,000 cases. It was a huge spike. And in that epidemic, it hit hard in Philadelphia, actually, where I am. 60% of the deaths were in children less than 5. And some of those, they realized, were children who didn't develop immunity after that just first dose. So in 1989, they revised the recommendation. Now 2 doses are recommended. And that second dose is now given when you're around 5 years old. And that brings that effectiveness that we heard about to 97%. So, in the Brady Bunch, none of the kids were less than 5, by the way. It was a fictionalized series. But the thing is just because it was common and it's a rite of passage, it doesn't mean it was harmless. You heard in that Brady Bunch episode, Alice even got measles, I think, in the end. But that's also, again, fiction, right? She probably had measles, if you think about it, because she was probably born before 1957.
And that's a great point. Yeah, I was going to say everybody before the vaccine got it.
Everybody got it. And everybody, basically, if you were born before 1957 in this country, you can consider yourself immune because you probably definitely had measles. So it becomes part of the MMR vaccine schedule. And, this is an interesting vaccine. It's always that has that little asterisk next to it. Maggie probably can tell us a little bit more about it, but it's not it's a live vaccine, but it's a weakened vaccine. So it's an attenuated vaccine, which means they've tweaked it a little bit so you can't actually get the disease, but it's enough to prompt your immune system to say, hey, I need you to do me a favor and give me some antibodies to this thing. So we rolled forward to the year 2000. Measles, like Brenda said, is declared eradicated. We're done with it. The only way you get measles at this point is if you've come in from abroad. And we hit a few bumps in the road every now and then. There was a Disneyland outbreak in 2014, and then we heard about the one in 2018. But essentially, we're done with it. Maggie, why don't you tell us a little bit more about what measles is? Why do we even need to talk about it? Why are there virologists who are still studying this?
Yeah, so this is a fascinating area of virology. It's a virus that can enter your respiratory tract, right? And it seeps into your bloodstream and then causes this big inflammatory reaction that can lead to really severe outcomes like pneumonia or brain swelling, like encephalitis, and then even death. And for most children and adults, yeah, it's the mild fever, cough, and the famous rash. But if you get it, you can then become vulnerable to other bad things. So we know now that the virus can knock out your immune memory, which means that then you're essentially able to get things that you previously were immune to after you get measles, which is a unique feature of this virus. And what makes it so virulent is that you can get it and infect other people without knowing, and you can spread it for up to 4 days, even before you have the rash.
Maggie,
so you don't know you have measles.
I gotta hit you on that point. That's so
Yeah.
interesting. You were saying that it it knocks out your body's virus memory? It makes you more prone to other viruses, or is this move us into perhaps triggering autoimmune disease? Like what do you mean by that?
Absolutely. So it not only knocks out your immune memory to other viruses, but to bacteria, to parasites. Basically, it kills off the cells that are responsible in your body for responding to other pathogens. And so they've done a lot of really interesting data that show this, as well as people who've gotten the virus and then subsequently had a severe bacterial or viral infection that they wouldn't have had that severe of a reaction to if their immune memory was maintained. And it can cause things. It's well linked to different autoimmune conditions. The encephalitis that it causes is linked to cognitive and behavioral changes in children. And so while that comes up a lot for the vaccine and has been robustly dismissed by the science, the viruses themselves that trigger brain swelling are a leading cause of some of these cognitive issues that I think a lot of parents are scared about. And then I think the scariest thing about measles is the subacute sclerosing panencephalitis. Very fun to say, but horrifying. You can recover from the virus as a child and then 10 years later die.
Maggie, I just need to hit that point again about that measles can knock out your memory or your immune
Yes.
system, because that's like going backwards. Do we know, is it if you get the actual infection, or can it happen if you also get the vaccine? And how does the body know the difference? Because it's a live attenuated virus. So why is it that it's okay to get the vaccine if having this reaction can cause that?
Yeah, so this is something that's really interesting. And the vaccine itself, because it's a weaker virus, right? So it was attenuated. It doesn't infect the same cells. It doesn't get to the same places. Wild type measles is the one that can infect your B cells, which are my favorite immune cell that make antibodies, and it kills them. And so then you lose that immune memory. But the vaccine does not do that. And so it's just the wild type virus that puts you at this particular risk.
That's crazy. It's the part of that this why this is so important is because measles is so contagious, right? So
Yes.
you end up in this situation where you can get a virus that could potentially move your immune system backwards. It's so contagious, it like hangs out in the air for up to 2 hours. I mean, we all heard about airborne diseases and catching it through the air with COVID. I mean, that's like a whole other playing field.
Yeah, but just explain that, because it's pretty illustrative of just how contagious this is.
Yeah, so like we talk about like a couple things. Like, look, if you have the flu, you're probably going to give on average give the flu to one other person. If you have COVID, you may give it to 2 or 3 other people. Measles knocks it out of the park. If you have measles, you're probably going to give it to like 15 people. So
It's top of contagious. Yes.
Yeah, it's the line. It's like off the charts compared to every other virus. And then you don't even have to actually be around that person. That person could have been in the room. They could leave the room, and you enter that room an hour or 2 hours later, and you could still get it. It still lives in the room. So if you walk into a room and you don't even know that there was a person who had measles there, and 10 people walk into that room, 9 of them are going to get measles. And then you have about 2 weeks before you start to feel like you might get come down with measles.
Hey, Mark, why don't you just walk through sort of the symptoms of measles? Like what happens to you when you get it?
Okay. So you catch measles, you might not even realize it for about 7 to 14 days. I mean, there's this like, incubation period, then you come down with something called a prodrome where you get like fever, you start to not feel well. And then the rash really, kicks in, right? So if you look in the mouth, this is sort of like a window into the world. You look into the mouth, and if you see these like specific white spots, then you're pretty sure that measles is about to set in. You get, the runny nose, the cough, the painful eyes, then the rash starts on the head, usually behind the ears or on the hairline, and then it spreads downwards on the body. Now, remember, this is a full body rash. Now, I'm a dermatologist. I have never seen this rash because we did such a good job at eliminating measles. So I've never actually seen it. It's something I've only read about. I see pictures on the internet, obviously. And it's, let's say you don't even want to focus on the 400 or 500 deaths a year. You want to look at some of the complications that can happen, right? So you get ear infections later, you can get pneumonia, you can get brain swelling, even myocarditis. We've heard about that word. And if you die from measles, it's going to be one of these three things: pneumonia, encephalitis, which is inflammation of the brain, or dehydration. And that was a really big point that happened even in these outbreaks that happened before. It's like patients didn't get the vaccine, and they also didn't seek care for some of the things that could save their lives. So even like getting IV fluids could save your life from, just dehydration. But, there's this like idea that you don't want to access medical care at all. And that really sets up a cycle where there's undetected virus, it's spreading in communities, and you don't even get treatment for it. Now, people say, oh, it's just harmless, it's not a big deal. But, 1 out of 5 unvaccinated people who get measles will be hospitalized. 1 out of every 20 children will get pneumonia. 1 out of every 1,000 will develop that horrible brain swelling. And then 1 to 3 out of 1,000 people will die. And then we haven't even really gotten into this, weird subacute sclerosing panencephalitis. We talked about it briefly. It's this like mutant form of the virus that slowly sleeps into the nervous system. And it's awful. I mean, you get seizures, you get progressive brain damage, coma. It nearly always results in death. So that's sort of the horrible side of it. But, there's the other side where lots and lots of people just get, rash, fever, and don't feel well.
Sure. And again, people who catch measles today are essentially going to be the unvaccinated population. If you had it, your immunity is lifelong. If you have the vaccine, you're most likely not going to get it. A lot of people heard about the MMR vaccine and thought about the MMR vaccine after the accusations that the MMR vaccine played a role in autism, which, as we've said many times on this podcast, was an assertion that has been totally and completely debunked years ago and put to rest by more studies than, I don't know what.
Look, and we know that vaccination rates have been dropping across the country really since COVID. I think something like 93% of school-age kids today are vaccinated, which is down from 95% before the pandemic. And the pandemic itself, we heard, resulted in a lot of parents mistrusting the MMR vaccine. Now you have something like 39 states that have this MMR vaccine rate below the target rate of 95%. So that means 280,000 kindergartners in America today have not had their measles vaccine. And look, requirements to be vaccinated is a state-by-state thing. In order to attend public schools, states have long required kids to be vaccinated, and this has been like a rock-solid thing. But more states are adding a religious exemption, and not just a religious exemption, but what they're calling a philosophical exemption for parents to opt out of the required vaccine. So this is all about the medical freedom movement, which is this sort of individual right to sort of decide what medical treatment you want to take, and for yourself or for your child. And now you're seeing a situation where there are these outbreaks popping up around the country. So Mark, tell us what's happening in Texas.
Yeah, I mean, now with, vaccination rates going down, there's windows of opportunity for the virus to, rear its ugly head. And it's happening right now in Texas. I mean, there's, at least 48 confirmed cases in Texas. And, one of the things that you think about, if you look at the CDC website right now, as we're taping this, it only says that there are 14 cases, but we know that's not true. And that's a little bit of an issue with just how data and information is being rolled out into the world right now. But, in Texas, 48 confirmed cases and at least 13 people have been hospitalized. And if you do, we did the math before, this is a high rate of hospitalization. They shouldn't be. If you have 48 confirmed cases in Texas, you shouldn't have 13 people hospitalized. Something else is going on. Why are they being hospitalized? All of these people are either unvaccinated or their vaccination status is unknown. So it begins in, Gaines County, Texas, and at the western edge of the state, it's bordering on New Mexico. And now there are state departments that are really paying attention to this.
Yeah, Mark, I want to play for you a conversation Tom and I had with two moms one of them you guys might remember, our listeners might remember, Melinda Hicks from episode 1 from Georgia. She was the one who was a lifelong Democrat who voted for Donald Trump in this election because of her feelings about health and RFK Jr. And she also introduced us to a friend of hers, Jacinia Muhammad, who, like her, is also a mother and who shares some of her concerns. We asked them, what do they think about all this news about measles? So let's play this conversation with Melinda and Jacinia.
Hi, my name is Jasenia Muhammad. I live in Northeast Atlanta, and I'm a mother of 2 girls.
And I'm Melinda Hicks, and I also live in Northeast Atlanta, and I am a mother of 1 girl.
I take the position that the vast majority of children are going to be okay. I never heard of anybody dying from measles. I know things like that happen, but I think they're the exception and not the rule. So yeah, I don't panic when I hear that.
We didn't used to do that. We didn't used to report on it. Nobody really freaked out over it. And, I'm the same generation as Jasenia. And it was just kind of par for the course. This is part of childhood, and you get it and you get over it and on you go.
I think about when I was a child and I would watch the Brady Bunch. And I remember when the Brady Bunch children got the measles and, they came home from school, their parents like, oh my goodness. Then you see another cut where now 2 more of the siblings have got it and they're all sitting in the room and they're just kind of riding it out until they get over the disease, and then life went on as normal. So when I hear people talking about the measles and you total up like 10 cases that they've mentioned, and I'm like, okay, there's over 350 million people that live in the US. It's not an outbreak.
I mean, prior to the measles vaccine coming on the market, 500 children a year died of measles. Of the thousands and hundreds of thousands of cases that would happen. And it's very unfortunate. Obviously, those children, every child's life matters, but you also have to look at, is there a real risk for healthy children? And it really wasn't. Yes, measles is highly contagious, but would you classify measles as deadly? I don't. How many parents of my age and Jasenia's age are going, no, it's not deadly. I don't think you can say that 500 out of thousands of cases a year before the vaccine is something that you consider deadly. I consider Ebola deadly. In fact, it's really interesting because if you look at the Merck manual, right? Merck makes MMR. The Merck manual says, and I'm just going to read from it because it's something that I looked up. I was curious as to how, they are classifying measles. And they have it classified as caused by a virus. Symptoms include fever, runny nose, hacking cough, red eyes, and red itchy rash. Although the majority of children recover, measles can be fatal or lead to brain damage. So even on the Merck manual, it says the majority of children recover. So I have a problem with children being forced to take a vaccine where the majority of them would get the disease and recover. Now, would I say if you have an immune compromised or otherwise, unhealthy child, that maybe that risk is worth taking the MMR vaccine? Sure, maybe. But again, that's up to the parents. The parents should have full informed consent.
If the pharmaceutical companies and the CDC want us to take these vaccines, it's incumbent on them to provide fair studies that we can look at and be like, oh, this wasn't sponsored by Merck. This was actually, sponsored by the American people. And, they've done the research. This is what they found. You want me to take something that you're not willing to do the proper study. And what I mean by proper study is vax versus unvax. I don't mean you gave this one the MMR and you gave this one the chickenpox. No, I'm talking about vax versus unvax. And then you can make an informed decision. But ultimately, it should be with the parents, because let me tell you something. My sister and the people I know that have to deal with these things, there's nobody there when you have to try to figure out what kind of childcare to get for your child. There's nobody there when your child is banging their head against the wall because their brain is on fire, or when they're flapping their arms or twitching or can't sit in the classroom. There's nobody there. The parents are the ones who have to take on the financial, emotional responsibility for these children. So it ultimately should lay with them.
I think there's a difference in philosophy in terms of sickness that some parents have that maybe generally public health doesn't have. I don't believe that good health comes from preventing disease as much as helping the body get through it and recover. I always looked at it when I was a parent as it's like an army. Okay, we have an army inside of us, right? We know that if something comes in, a pathogen comes in, our body has to be ready to fight. It has to be strong. We do that with nutrition. We do that with sunlight. We do that with exercise. We do that with all kinds of things so that, sickness is inevitable. Either you're going to get measles or you're going to get the cold, or, you're going to get flu, or, like my daughter had strep at one point. I want her body to be strong. And one of the ways that you test an army is by putting it through its paces, right? And you don't put it through its paces by preventing every single disease.
Okay, so that was Jacinia and Melinda. And joining us now is Dr. Paul Offit, who is an infectious disease specialist, a pediatrician, a legend when it comes to the topic of vaccines. And Paul listened to this conversation. So, Paul, let me ask you this question. What do you say to Melinda and Jacinia, who feel like measles is a disease that, everybody kind of got when they were little? They got over it. And if anything, it strengthened their immune system. What do you say about the idea that people are making just too big of a deal out of a disease that everybody kind of got and recovered from?
Right. So as a child in the 1950s, I had measles, I had mumps, I had German measles, I had chickenpox. There were certain diseases that were considered childhood rites of passage. Rubella or German measles was one of them. As a general rule, that was a fairly mild disease of children. Where that virus was particularly dangerous was when it infected pregnant women, where it caused a very high percentage of children who then had birth defects, blindness, deafness, and heart defects. So, and chickenpox at some level. So those two were generally considered childhood rites of passage. I can tell you that my parents did not consider measles a childhood rite of passage. Measles made you sick, and measles made you suffer. So the discussion between these two women sort of focused only on deaths, although again, 500 children died. You roughly 0.1% or 1 to 1,000 children roughly who were infected with this virus died. And 48,000 roughly were hospitalized every year with severe measles pneumonia or severe dehydration or both. If you can prevent that and prevent it safely, why wouldn't you do that? Now, I think it's always reasonable to ask the question, at what price? Meaning, what are the side effects of this vaccine? Because anything that has a positive effect in medicine, including vaccines, can have a negative effect. So sure, if there have certainly been episodes, I can think of a handful of episodes where ultimately the risks of a vaccine outweighed its benefits. And so it came off the market. That's not measles. The measles vaccine was a rare cause, meaning roughly 1 in 35,000 would have a lowering of the platelet count. So platelets are that cell in your body that helps clotting. And so they would get these so-called petechiae, which is this kind of showering of little broken blood vessels without sequelae. It would happen usually 10 to 14 days after the vaccine. That's pretty much it. If you argue, look, the measles-containing vaccine causes autism, and therefore I don't think I should get the vaccine, I agree with that. I don't think it should either, but it doesn't. And so here's a safe way of preventing the most contagious infectious disease, not just the most contagious vaccine preventable disease. This is the most contagious infectious disease, as Mark alluded to earlier. And I think, and we have a safe and effective way of preventing it. It's interesting that they talk only about death. How about suffering? It's not fun being in the hospital. It's not fun having pneumonia. And a fairly large percentage of children who have measles have pneumonia. Measles in many ways is a pneumonia.
Paul, I think one of the things that hit me was the comment about, if your child is immune compromised, then go ahead. But I think it's important to underscore that healthy children get measles and get severe complications afterwards. And you don't know if your child is one of those or not.
Right. Okay, if I could have one thing, because I'm old, so I've gotten to see a lot of things in the decades and decades that I've lived. But the one is SSPE. I've seen 5 cases of that. So SSP, which stands for subacute sclerosing panencephalitis, is a chronic measles infection of the brain. It usually presents years later, and you watch a child fall off a cliff in slow motion. Initially, they just sort of have a deterioration in handwriting skills, or there's some changes in their personality. Then they have motor deficits. Then they have sensory deficits. And there is nothing you can do about it. You just watch them die slowly. Watch that a few times and know that you can prevent it. And why wouldn't you prevent something like this? So the goal of vaccines is to keep you out of the hospital, keep you out of the intensive care unit, and keep you out of the morgue safely. And this vaccine does that. I think we've not just eliminated measles. I think we've eliminated the memory of measles, and that's part of the problem.
Yeah, I think I think it was illuminating to talk with these women, and they're very thoughtful, and we were very grateful to hear their thoughts on this. I think we're looking at it wrong. I think the way they look at this situation is the vaccine is the threat. The vaccine is the problem. The vaccine is the Russian roulette. And it's not worth playing Russian roulette with a vaccine if, for the vast majority of healthy kids, it's going to be a week home sick. And this also extends over to the argument that, hey, part of the reason why you're being called on to get vaccinated, even though your child's healthy, is because there's a lot of kids in the community who can't get vaccinated, or it won't work for them because they're immune compromised. They look at that as like, I feel terrible for those kids, but as a parent, my first responsibility is to my own child. And I do not want to play roulette with my own child's health by putting this vaccine into them. So as I care for those other kids and I wish them the best, I've got to look out for my kid. And that means not getting vaccinated. Paul, what goes through your mind? Because I think for you, who sees the science and sees the studies and have seen it for decades, you say this is every vaccine has a risk. Everything we do has a risk. But this is a really essentially harmless thing that is going to help prevent you from getting a nasty virus. Why wouldn't you take it?
I think there's this kind of myth of invulnerability. I think people never imagine that anything bad would happen to their child. And therefore, the risk in their mind is giving the vaccine, because there you're doing something which can have a side effect, and it can have a side effect. I mean, measles vaccine can induce this sort of lowering of the platelet count, and although it's transient and self-limited and it really without sequelae, that is a side effect. It is a live weakened viral vaccine. So I'm giving my child a biological agent that I don't understand particularly well to prevent a disease that for the most part I don't see. So why do that? And I guess what's compelling to me is talking to like parent advocacy groups like Families Fighting Flu or Meningitis Angels or National Meningitis Association or PKids, parents of kids with infectious diseases, because all these parents tell the same story. They too had this myth of invulnerability until it happened to them. And that's what they say. I can't believe this happened to me until it happens to you. And then they see a purpose in that. God bless them. I don't know how they manage the strength when they have a child who either suffered significantly or died of a vaccine preventable disease, who then see themselves as being on a mission. I'm going to tell people about how important this vaccine is or how bad this disease can be. So I think that's the problem. You never think it's going to happen to you until it happens to you. I mean, my children, not surprisingly, are fully vaccinated, but I never imagined they would ever get any of these diseases.
Paul, one of the things that Jacinia and Melinda talk about is something that we've heard from multiple people, of course, RFK Jr. and others, but this notion of natural immunity and the idea that getting a disease is like I got measles as a kid when I was in India, and I haven't gotten the measles vaccination because I got measles as a kid, right? So this notion that getting the disease strengthens your immune system, how do you respond to that? Because the same thing came up during COVID, right? Talk to me a little bit about that.
Well, is it better to be naturally infected than vaccinated? Yes, in some ways, assuming you live. That's the catch. So I was naturally infected with measles virus. My children were inoculated with measles vaccine. I probably have a somewhat higher level or frequency of memory B and T cells having had a natural infection than they have getting vaccinated. But the goal is to induce a level of protection that mimics natural infection without having to pay the price of natural infection. And vaccines do that. I mean, it is amazing to me, frankly, that we had a vaccine that came in 1963. There were a couple of vaccines that came in, measles vaccines that came in 1963. The last best measles vaccine was in 68. We had the second dose recommendation for measles vaccine in like 1989. And with that, we eliminated the most contagious infectious disease. I think that is a remarkable achievement. But again, I think we've eliminated the memory of that disease, which is why people can be at some level glib about it and refer to that Brady Bunch episode where Marcia Brady had measles. But I really do think, if I remember correctly, she later apologized for that
She
episode.
did. She said,
No
and
way.
I think actually the creators of the show's kids also said my parents would never want to have been involved in making a show that is being used to question vaccines.
Paul, you heard them talk about vaccines, and let's almost go backwards in time and let's talk about the studies, because they want us to give data that is a way for them to have more informed consent. And one of the things they mention is, let's do a new trial where you have a group that's vaccinated and a group that's unvaccinated. And so we can really tell, why should we not do that? Should we do that?
Okay, well, if you're talking about the MMR vaccine alone, you can do that. You can do a retrospective trial looking at people who got the vaccine or didn't, but those are not easy studies to do, because a person who chooses not to get a vaccine may be different in terms of their healthcare seeking behavior or their medical background or their socioeconomic background. So you have to control for that. That's why that's hard to do. When you talk about just vaccinated or not vaccinated, period, that's even harder to do, because someone who completely chooses not to get any vaccines is very different than someone who's choosing to vaccinate their children. So you have to control for those things, and it's hard to do that. Peter Aabye, spelled Aaby, has done some of those studies, but if you look at on balance, you're better off, not surprisingly, being vaccinated.
Is it okay to do a kind of study like that? Is it ethical to do?
No, not prospectively. You can't choose not to give a group of children vaccines, so you can only do that retrospectively, which is why it's difficult to control for the confounding variables.
Okay, so let's talk about how we get to approval. You get to approval by doing studies. Those are expensive. Who's paying for those studies? And is there a conflict of interest there?
Okay, so I was fortunate enough to be the co-inventor of the rotavirus vaccine, RotaTeq. So I sort of have a front row view of this. And my two co-inventors, Stanley Plotkin and Fred Clark, were all part of this. And so only pharmaceutical companies have the resources and expertise to make vaccines. It's $1 billion to $1.5 billion in the research and development costs. Fred, Stan, and I weren't going to sort of contribute and do that ourselves. So only they have that capacity. And then when you get to the big trial, the phase 3 trial, the safety efficacy trial, that trial, for example, was a prospective, placebo-controlled, 72,000 infant 4-year, 11-country study that probably cost about $350 million to prove that the vaccine was safe and effective. Now, people don't trust big pharma. They don't, and reasonably. I mean, certainly pharmaceutical companies have acted unethically and sometimes aggressively and sometimes illegally. Generally, I would say with confidence that does not apply to vaccines, because vaccines are not a big moneymaker. They are a fringe market. I know it's hard to believe that following COVID and watching the windfall profits for Pfizer and Moderna, but vaccines are something you take once or a few times in your lifetime. They never compete with things like lipid-lowering agents or psychiatric agents or neurological agents. So that's true. And so now the vaccine is licensed. Now, the good news is there's no hiding. So when the company submits to the FDA looks at every primary piece of data, So I'm on the FDA Vaccine Advisory Committee. When you get when a vaccine is being submitted for either authorization or licensure, you get about 150 to 200 pages from the company. And you also get 150 to 200 pages from the FDA, who looks at every piece of primary data to make sure nothing is omitted or misrepresented. And sometimes they think that things were kind of slanted in a certain way, and they make that very clear in their document. And then comes the vaccine is out in the marketplace, and there is no hiding. There's the vaccine safety data link. If your vaccine has a side effect problem that you try to omit or hide, it will come out. There's no hiding from the vaccine safety data link. So, for example, with the COVID vaccines, you found that Johnson & Johnson's vaccine was a very, very rare cause of clotting, including severe clotting, including fatal clotting, that ultimately drove that vaccine off the market within 2 years of its coming onto the market. And it occurred at 1 in 250,000 people. That's not anything you're going to pick up pre-licensure. licensure, but was picked up very quickly post-licensure. So there are systems in place to make sure that if you're interested in cheating, you're not going to be able to cheat for long. Also, there's not much interest, frankly, in the companies lying. There isn't. I mean, the FDA is it. They have to convince the FDA if they're going to get their product on the market. It's not to their advantage to lie. It isn't.
But let me push you on something you just said, which is that pharmaceuticals right now are the only people who can afford to run these studies, right? Or run these trials.
Right.
Is that a problem? And is that a place where, if the very companies running the trial are also the companies that do stand to benefit from the use of their product, can you understand why somebody might see a conflict of interest there? And is there some reform that we could take to sort of, either empower other people to do the trials or somehow kind of disassociate the profit part of this equation to the intent to kind of study something?
If there wasn't a profit motive, you wouldn't have vaccines. It's that simple. The companies are in it to make money, no doubt about it. They're in it to satisfy their shareholders, no doubt about it. But they're the only ones who can do it. They're the only ones. I mean, the old joke is that the government, if the government were to make vaccines, they could never meet government regulations. I mean,
but
they
Paul,
are really
isn't it like when Coke studies sugar in kids, right? It's like Coca-Cola sponsoring a diabetes studies is like one way that people are viewing pharmaceutical companies studying vaccines. What do you say to that?
If Coke wanted to make a diabetes study, it wouldn't cost them $350 million to do it. I mean, if you're going to do if you're going to do the phase 1, phase 2, and phase 3 studies for a vaccine, that's going to cost you in at least $1 billion and sometimes $1.5 billion. Only companies have the resources and expertise to do it. It's hard to make a vaccine. I mean, you have to prove that each of the strains that are in there need to be in there. You have to have the right buffering agent, the right stabilizing agent. You have to do real-time stability studies. That is not easy to do. And only companies really have the resources and expertise to do it. I see no other way around that. And if the government did it, people still wouldn't trust it. So I'm not sure that solves the problem.
I think that's the key, is there needs to be this synergistic relationship, because ultimately the bench science that happens well before we get into clinical studies is funded by things like the National Institutes of Health, and it's laying the foundation for things that might be effective in the clinic. But that all happens, and there is a pot of money for that. That happened in the 1950s to 65. It was taxpayer funded to do some of the preliminary bench science, but the funding for the big clinical trials just couldn't be done outside of industry. And I think that's the other thing, at least from my perspective, is we could have so much more innovation in the vaccine space. And I'd love to know your thoughts, Paul. But that's part of the rub, is the return on investment for companies hadn't been very high. Vaccines weren't seen as a lucrative market for them. And so there wasn't this drive to come up with new strategies, new dosing schedules, new ways to combine different viruses. Do you think that we could see a shift in that innovation space now? Or do you think this is going to take a step back because of the concerns we're seeing?
No, I worry it's going to take a step back. I mean, first of all, I completely agree with you. I mean, if you look, I and my coworkers were funded by the National Institutes of Health for 25 years. I mean, and then we created strains we thought could be a vaccine, and that's when sort of Merck ultimately moved forward with it. I mean, look at. I mean, who's the real hero of the COVID pandemic? And to me, it's people like Drew Weissman and Katie Carrico, who were funded by the National Institutes of Health to study mRNA since 1997. And then in 2002, 2003, when SARS-1 raised its head, there was in-house work done by people like Barney Graham and Kizzy Corbett, to make an mRNA SARS-1 vaccine, which never came to be here because the virus really never came into this country. But it was that work by NIH. I mean, everybody looks at Operation Warp Speed, which was certainly phenomenal, but that was really a production issue. I mean, all the research and development really happened before that because of NIH. And I think when you hear RFK Jr. say things like, let's give infectious diseases a rest for a while, first of all, they're not going to be giving us a rest for a while. So that's a mistake. I just think there's a lack of appreciation of just what NIH did in all this and does. If you read Robert F. Kennedy Jr.'s book, Real Anthony Fauci, there's 4 pages in there from like 285 to 288 where you see where he's coming from, and it's in many ways also where one of the women who were in this conversation is coming from. In that section, it's called miasma theory versus germ theory. Okay, so the germ theory, which was solidified in 1875 when you showed that specific viruses or bacteria could cause specific diseases, has allowed us to live 40 years longer than we did before because we now can treat and prevent those diseases. But that's not where he's coming from. Where he's coming from is he doesn't believe that viruses and bacteria cause disease. He doesn't. I mean, when he was in Samoa, he made a point that he didn't think wild type measles virus was causing that outbreak, even though the D8 strain of wild type measles virus was isolated. He says that he thinks that the Spanish flu pandemic rather, in 2018 was caused by a vaccine when flu vaccines weren't available until the 1940s. He doesn't believe specific viruses or bacteria do that. Rather, he believes in the miasma theory, which stated, at least in the 1700s in Europe, that there was this sort of organic matter that was kind of rotting on the streets that would release this kind of bad air. Well, his modern day miasmata are things like pesticides, food additives, dyes, and vaccines. Those are the modern day miasmata. And all you need to do to avoid infections in this case is just have a strong, healthy immune system. Eat right, avoid pesticides, and avoid environmental toxins. And he considers vaccines to be an environmental toxin. Just read his book and listen to what he said.
No, I think you're getting at an important point, and I think we've pit this sort of infectious disease versus chronic disease binary, I think recently in this country, and that feels like an unfair duality to present to people, that it's got to be kind of one or the other. And I'm wondering, look, I hear what you're saying, Paul, about he's written what he's written about germ theory and all of these things, but is there some truth to having a healthy immune system, eating well, eating right can help you prevent these diseases? And that is something we should be looking at. And that is something we should be funding. And that is something that as a country, we should all get behind. And if that's going to be his main platform, we should support him in that.
Well, I'm all for eating well, eating healthy, exercising. But the only way to be protected against a virus like measles, for example, or the viruses we're talking about, is to have specific immunity. And the only way to develop specific immunity is either with natural infection or vaccination. And vaccination is always the better choice. And when he says chronic diseases, what does he really mean? I mean, when he testified in front of the Health Committee and the Finance Committee, he made it very clear what he meant for children. He said, the incidence of chronic disease in children is higher than it's ever been before. It's higher than in any other country. 1 in 36 children suffer chronic disease. That's what he said. Why 1 in 36? Because that's the incidence of autism spectrum disorder. So he believes we need to get to the root causes of that. We need to put NIH on what are the root causes of that. Well, there's actually a lot of information about that, about causes of autism. And one thing you can say with confidence in the world of environmental factors is vaccines isn't one of those factors. And if I were a parent of a child with autism, I would be really angry that the anti-vaccine activists have taken that disorder hostage and diverted attention and diverted resources away from far more promising leads.
Paul, one of the things we heard about is we're just making too much of a big deal of this. And I know we went through all of the dangers of measles, but one of the things they're saying is, 50 kids have it in Texas. So what, right? There are 10.3 million cases of measles that happen in the world. And now suddenly we're going to talk about and obsess over the 48 cases that are in Texas. And it's this government overreach. Like, why do we define an outbreak as just 3 people? Is that just a bad match? Like 3 people, all of a sudden you're going to tell me this is an outbreak? We have the data. We have a story that we're telling about measles and the encephalitis and all that. They have a story that they're telling, Brady Bunch, and everybody's fine. Paul, you need to calm down. Where is the truth about the level of attention? I mean, why do we obsess over 48 cases if in the world and somebody could fly on a jet and give us an outbreak? Why do we care about 48 cases?
Okay, so we eliminated measles from this country in 2000. And by eliminating it, that didn't mean that measles, people with measles didn't come into this country. People with measles came into the country all the time. But what happened, we had a high enough immunity where it couldn't be spread then to a child who would then spread it to another child and another child. So that's where the sort of the three comes from, that you're spreading it from American child to American child, that's sort of the inception of a potential, broader epidemic. I would say this, though. You're not going to see measles. What you're going to see is what you're seeing now, is that there, I think, are 7 states now that have reported outbreaks. And that 48 cases is not just 48 cases. I'm sure that's true, because these are confirmed cases, meaning confirmed by PCR or confirmed by serology. They've been tested. I'm sure there are people who have been in contact with these who may have the inception of measles that haven't been tested yet. Also, doctors aren't used to this virus. Most young doctors have never seen this virus before. And when they said that there were 48 cases and 14 hospitalizations, remember, before there was a measles vaccine, there were 3 to 4 million cases and 48,000 hospitalizations. So that was a very high hospitalization rate. And it makes me think that they're not used to this virus. And even in Philadelphia, Children's Hospital of Philadelphia, we admitted 2 kids. And I remember saying to my younger infectious disease physicians, why did you admit these children? I mean, you admitted children who had measles because they had pneumonia severe enough to require either oxygen or other respiratory support, or they had dehydration severe enough where they couldn't rehydrate themselves. I mean, I'm scarred by the 1991 Philadelphia measles epidemic. We're in a 3-month period in Philadelphia. Now, this is 30 years into the availability of a vaccine. We had 1,400 cases and 9 deaths in our city. I mean, schools canceled trips to the city. Our city was a feared destination. We vaccinated down to 6 months of age. People were scared to death about what was going on in that city. And that's just one city over in the winter. And when you start to see these things occurring, you worry. It's like at the beginning of every horror movie, there's often someone who says, did you hear something? And that's what I feel this is. I think I'm starting to hear something.
Well, I want to just bring you back to the 2 women we heard from, Melinda and Yesenia. They are deeply concerned about the health of our kids. They're deeply concerned about modern life. They're deeply concerned about vaccines, about uptick in allergies, in autism, uptick in ADHD diagnoses. They see you as someone who has taken funding from Big Pharma to study and even to make vaccines. Why should they trust you?
Well, first of all, I didn't take money from Big Pharma. I was funded only by the National Institutes of Health. I mean, my research was never funded by a pharmaceutical company. So why did I do it? I mean, why did I choose this course? I mean, why did I choose research as a course? I mean, it wasn't like for the money. I mean, when I finished my fellowship and then just was funded by the National Institutes of Health, I made $12,000 a year. I mean, because I love it. I mean, I love the process of science. But I saw a child die of rotavirus when I was a resident, and it struck me. I mean, here was a 9-month-old little girl who had rotavirus, which is a cause of fever, vomiting, and diarrhea. And the problem is the vomiting. It's very hard to rehydrate children orally who are vomiting. And she very quickly became dehydrated. And the mother was doing everything she could. She was a good mom in the suburban Pittsburgh area. And she was doing everything the doctor was telling her to do. Drinks small sips of fluid that contained sugars and electrolytes. And nonetheless, the child became dehydrated in her face. So she came into our hospital. We brought her back into the treatment room. And we're trying to save her life by putting an intravenous line into her arm or leg. But we couldn't because she was so dehydrated that her veins had collapsed. So then we did something I'd never seen before, which is clysis, which is you take a large bore bone marrow needle, sort of drill it into the bone marrow, sort of the upper part of her tibia, and then try and get fluids into her bone marrow while you're waiting for the surgeon to come down to put an intravenous line into her neck. And she died in front of us. And then you have to walk out of that room, that treatment room in the emergency department, and go tell the mother of a 9-month-old child who was perfectly healthy 2 days ago that her child has died. And that is something that lives with you for the rest of your life. And when I came to Children's Hospital of Philadelphia, and they had just started the year before a rotavirus program to sort of learn about the virus, I mean, that's what I did. And so my research was all based for the 25 years that I did it on trying to understand sort of selected aspects of the virus. What part of the virus made you sick? What part of the virus induced an immune response that was protective? Could we make strains that could be a vaccine? And that was the motivation for all that. And then we were lucky. I mean, we were lucky that we were part of a team that ended up standing up when the music stopped on this. We were part of 200 other principal laboratories throughout the world that were doing this. And it was a grand quest. I mean, I don't think anybody goes into science and think, boy, if I can just figure out which of these two surface proteins evoke antibodies, I can be rich. I mean, it just so happened that we did that. Now, let me say this to my detractors is, okay, now we had strains that we thought could be a vaccine. The only way a pharmaceutical company is going to advance this, and they're the only ones who can, is to protect the technology, i.e. patent it. So me and my two co-inventors patented those strains, and then Merck moved it forward and it became a vaccine. Now, when it became a vaccine, and our hospital then sort of sold out the rights to the patent, because remember, although we are on the patent, my hospital owns us because we are the intellectual property of the hospital. So they sell out the patent, they keep 90% of what they sell it out for, and they divide the remaining 10% among three inventors. So yes, I did end up making money for that 25-year effort, but that certainly wasn't the driving force to do it.
And just to pick up on that, if someone says that, your enrichment off of that, how can you continue to assure people that the money that you're receiving from that is not somehow clouding your judgment, your scientific judgment in researching these illnesses?
Well, I wouldn't say had received. This was all done by 2008. So we're almost 20 years into my having received any money from.
And you bought a big lakeside home in Lake Como with all your returns, right?
Right. That's what I did. I just, otherwise, that's what I should have done, right? Just retired and just ignored the hate mail. But because it just seems to be getting worse. But in any case, well, here's what I would say. First of all, I voted against the smallpox vaccine when I was a member of the Advisory Committee for Immunization Practices. I was the only one who voted against that because I didn't think we needed to move forward with that program at the time.
Why?
Because, this was right before we invaded Iraq. The concern was that a rogue nation or group would use smallpox as an agent of bioterror. And so the George W. Bush administration wanted to vaccinate all frontline responders, and even really more than that, with the smallpox vaccine. So first of all, the smallpox vaccine has a difficult safety profile. I mean, that vaccine can cause myocarditis, it can cause pericarditis, and it can cause fatalities. So that's number one. Number two is that smallpox is never asymptomatic. There's no such thing as asymptomatic smallpox. If you're exposed, you're going to know it because you need to be within 5 feet of somebody who has smallpox. It's usually the blisters that rupture inside of the mouth that then spread the virus. And also, we hadn't had a case of smallpox in the world since like 1980. So why don't we wait for one case somewhere before we launch a program with a vaccine that has a dangerous side effect? And that vaccine was made, by the way, with all the technology that was available in the late 1700s. I mean, it was still made in that same way. That's sort of,
let me just underscore that, because I think that is a really important thing you just said, which is that you used your expertise to recommend that we not get a smallpox vaccine at a time when the government was trying to get everyone behind this idea as part of a national security strategy. So what you're saying is you're not a guy that just says vaccinate, 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 sort of throwing adverse events like caution to the wind.
No, and also when I came onto the ACIP, Advisory Committee for Immunization Practices, in 1998, I asked to be head of the polio working group because I thought it was unconscionable that we were still giving the oral polio vaccine. I mean, we gave the inactivated vaccine, Jonas Salk's vaccine, from the mid-50s into the early 60s. That was replaced by Albert Sabin's live attenuated oral polio vaccine, which then allowed us to eliminate polio from the United States by 1979. But that vaccine could revert to essentially neurovirulent type or paralytic type. And so you could get polio from the polio vaccine. It was rare, maybe 1 per 2.4 million vaccines, but it was real. And throughout the 1980s, throughout the 1990s, the only polio we saw in this country, and it was 8 to 10 cases a year, was polio caused by the polio vaccine. So I asked to be on the polio working group. And so we moved to the inactivated vaccine. I think it's actually my greatest public health accomplishment was moving us away from the oral polio vaccine. I also voted against the bivalent COVID vaccine, which I thought was not any better than what we had with the monovalent vaccine. So I don't see myself as a vaccine advocate. I see myself as a science advocate. And when it supports vaccines, great. And when it doesn't, great.
And you see yourself as a skeptic.
Yes, that's why I think all of us that sit around the table at the Vaccine Advisory Committee are skeptics. Show us the data. It's simple. It's just so easy. It's so easy to dismiss what people like me say by just saying, well, you're just in the pocket of the pharmaceutical industry. And it works. I mean, it works in this culture. That works.
Well, look, I'll say that one of the goals of our show is to take these conversations out of the hyper polarized arena that they're in, where often how you think about public health and whether you got a vaccine or not determines it tells me who you voted for and how you feel about a slew of issues. And really, we just want to bring it back to, it's okay to have concerns about, your kid's health. It's okay to wonder about the safety profile of a vaccine. It's okay to even wonder whether natural immunity is just as strong as a vaccination, and to sort of take those questions out of these politically charged kind of spaces that they've been put in. So look, I really want to thank you, Paul, because I think you add a lot of clarity. And I think it's really important for people of your stature to be challenged to answer questions like this, because I genuinely believe these kinds of conversations are part of the building blocks to rebuild trust. So I want to thank Dr. Paul Offit. I want to thank Melinda Hicks. I want to thank Jacinia Mohammed. And I'm Brenda. He's Mark. She's Maggie. He's Tom. Please send us any questions at whyshoulditrustyou.net. Please rate, subscribe, like, review. If you don't like us, just maybe email us that you don't like us. And we'll see you again next week.